How is oral health related to general health?
Gum disease has been shown to impact systemic health. It is a potential cause, and the evidence is mounting that it is, for cardiovascular disease of the vessels of the heart, even for the atherosclerotic changes of other vessels in your body. That means the narrowing down of those vessels. And this is because gum disease is caused by bacteria. It is an infectious process. And those bacteria get into your bloodstream. In fact, if you have gum disease, when you eat, bacteria are gaining access to your blood system. And they're shown to be in there. And those bacteria cause the walls of the vessels to become inflamed a little, and their properties change such that another kind of plaque, cardiovascular plaques, which is calcium and fat deposits, build up on those inner linings of the vessels. And there is a very strong correlation between gum disease and cardiovascular and atherosclerotic changes in people. This is not dissimilar from when people would have ulcers and nobody knew what was causing ulcers. Drink milk and do this and do that. But meantime, it turned out that there's a specific bacteria that causes stomach ulcers. And if you take an antibiotic for long enough and large enough doses, very specific one, you can beat your ulcer. Now, we have not found a way for patients to take an antibiotic and beat gum disease. That hasn't occurred yet. People are always working on it, but it's not here yet. But what we do know is that it's highly probable that at least cardiovascular disease is directly related to gum health. And that if you have a concern for the health of your heart and your blood vessels, you may want to have somebody examine you for the presence of gum disease. And let me be clear about this. When something is correlated, like the periodontal disease is highly correlated with changes in blood vessels and heart vessels, that means that they are associated with each other. But that is not the equivalent of one causes the other. And sometimes one wants to conclude that. But that can't be concluded unless you can actually show and prove that one causes the other. We're just looking at statistics. But it certainly seems to make sense that the prudent thing to do is to make sure you don't have gum disease, periodontitis, if you're interested in having as healthy a cardiovascular system as possible.